Every 11 seconds, an older adult is treated in an emergency room for a fall-related injury. And knowing the kind of community that we have, we love our senior citizens. We want them to stay healthy. We want them to stay strong all year long, which is why Physical Therapy and Balance Centers is here in Sierra Vista to do just that. In this video, we're going to take a quick walk around their amazing complex here, right next to Tap Into Wellness, and we get to meet one of the fantastic doctors who is making her way in right now, into frame, into the screen, and then all the way out. No, I'm kidding. Get back over here, Dr. Suzanne. Hey, lovely to
nice
meet you.
To meet you.
Thank you so much for taking the time to talk to us today. So Physical Balance Centers has been around for how long?
Probably since 2014. It was the CEO of Planet Fitness, of all things.
Interesting.
I know. And so there was a niche to be filled, and they filled it. So we're a franchise, and we deal with vestibular, balance, and pelvic floor, our specialties. And they're things that are often overlooked, and they kind of go together, to be honest. I mean, you don't want to lose your balance running to the bathroom because you're having continence issues, for instance.
Yeah.
So I don't think they meant that, but that's how I see it. So you can combine and treat all of the things to help people live a normal life that they don't dread, and they could do all their fun activities without worrying about leaking or falling or the room spinning.
Yeah.
And this organization sets me up with all kinds of education to make sure we're at the top level, and it's all free, and I take as much as I want. So I've been taking a lot of courses and becoming very educated in all these things. So.
Excellent. Well, let's talk about that fact that we began this video with. Every 11 seconds, an older adult, a senior citizen, experiences a fall-related injury. What are the tools that you use here at Physical, here in Sierra Vista on Paseo San Luis, that you use to make sure that this helps them after the fact or preventing that?
Well, I'm glad you asked, because we have the only one in the county, one of these SOS suspension units. And this thing will hold people.
Man, I didn't even notice it. It's rigged all the way across.
Yeah, so this will hold people up so they cannot fall. So if you have someone high risk or you want to challenge their balance, you don't have to worry in this harness. And we could have them throw a ball, go around cones. We have hurdles here. I mean, this is way fun, right? I mean, what's not the love?
Yeah. Oh, okay.
And then we have the shuttle, which also helps balance. To me, it's like being on a boat.
Yeah.
And I love that. So they could get challenged this way as well. And this is the hardest way, by the way.
Yeah.
I know. And they could also...
And they're also strapped in.
They're strapped in or not if they're doing pretty well.
Right.
So we could treat paraplegics, try to get them to walk again. We had one earlier today. And in the suspension unit, we don't have to worry about them giving out or falls. So you could try higher level activities with this unit. And also, just so you know, I'm fellowship trained in manual therapy, so I do a lot of orthopedics work, and sometimes weakness, especially weak ankles, will cause a loss of balance. And so I can really help with those skills to get them back, no pain, stronger, in case that's causing balance issues.
Living a pain-free life, I mean, that's something that everyone is entitled to. We all deserve a pain-free life. Right. And having those joint discomforts and things from either falling, traffic accidents, anything, any sports related from 20 years ago. I had this, I had a knee that kind of gave out on me, and it all catches up to you.
Right.
But that's where Physical can come in and address those specific issues.
Right. And we can test to see how much is proprioception or body awareness, how much is visual, how much is vestibular. And the part that this place really shines in compared to other places is it gets you at the level you're at and not beyond, so you get that stronger. You don't want to exercise too difficult to where you compensate. And people will compensate with their vision. So you take their vision away, like, whoa, right? Yeah. They'll compensate with other and so that's what I like about this place. You try it. They have a 48-point system to assess balance, and it's pretty intricate, and to find out exactly where are they and what do they need to do. It's very methodical to get better.
But isn't that important, because that shows that every person receives an individualized treatment.
Yes.
And does that. So looking at this room here, we'd love to take a look around the rest of the place. And
of course every physical therapy has the balance bars.
Yeah.
I went ahead and bought a ladder because I have older people that are like, yeah, I'm going to go home and put a window in now and get up on my ladder. I'm like,
let's
well,
practice
practice
that.
here.
Let's practice that.
Hey, I
in
want
a
you to
safe
push
environment.
down and not pull,
Yeah.
you know, so you don't land on your butt if your hands slide. So I like to keep it really functional, really worthwhile, very holistic.
Well, because again, balance, like you said on the wall right there, balance is core to wellness. It really is. And it is part of our core as humans. You know, we need to have a strong core in order to maintain that balance.
That's right.
So what's going on in this room? This looks like a weight room.
Yeah, we got weights. We got stuff to do cardio, such as treadmill and a bike, balls. I love to exercise on balls. I had a gentleman in this morning with vestibular issues, and it was this horizontal canal, which is odd. Usually it's the posterior canal. And this is really fascinating. I'm like, well, it's rare to get horizontal. And it turns out he's a rifle shooter.
Okay.
And his head cocks to the side when he shoots. You know, the what's it called? The
recoil. Yeah.
Of course, you guys know.
Yeah.
And the recoil, and I'm like, oh, no wonder it was your horizontal canal. Like, and we actually looked up on PubMed, and there was an article about that. Yeah, ski shooters, they get vertigo from the crystals knocking off the matricular bed into the semicircular canals. I'm like, whoa.
Don't patronize me. I know what the matricular circles of I know what that is.
But it's like, that was so cool. So every day is like that, where you come up with, whoa, look at that, you know? And I just thought it was great because Arizona, we get a lot of shooters.
Right.
So if you shoot guns and you're dizzy, come to Physical Therapy and Balance Center. I would not say that where I'm from in Washington, D.C. I just want to put that out.
Wild, wild west here. So again, using this room, looks like the pool noodles here and for all the different, back exercises?
Yeah, like people that are kyphotic. So if you think about it, when you get older, you end up like this, and then you go to reach, and then you fall backwards, crack your skull. Oh. Right. So I try to get this moving a little better. I got a great pool noodle from Costco.
Yeah.
Because older people can't handle the hardness of the other rolls.
Yeah.
$20.
Yeah.
And they could easily just, just kind of do this. Oh, it feels so good.
Yeah, what a great stretch.
Yeah. And I also tell them to stagger their stance when they reach for the rest of their lives, just to stay safe. And so safety first.
So even just in daily life, you're giving them tools and exercises to be able to use
the rest of their life
in order to maintain that balance and improve the balance.
And be safe.
All right, well, let's go on and keep on going through here, Dr. Suzanne.
Yeah,
we're here.
And study
Physical Balance here, right next to the Tap into Wellness on Paseo San Luis. Taking a look at, look at this room right here.
Yeah, I'm into I like lighting. We have a lot of people with anxiety, and so I try to calm them down and relax them. We do a lot of deep breathing. I did my whole doctorate on deep breathing disorder and what happens if you hyperventilate and how that affects everything. And so I incorporate that in everything I do. The breathing, if you shallow breathe, you have more postural sway, and that lends to balance. So I've done this 34 years, and everything I've learned through my doctorate, through my fellowship, and now through all this training with vestibular, pelvic floor.
Let's go talk about pelvic floor. I mean,
yes.
Because that's something important as well.
I'm putting it all together, and it's never been more fun to work.
I mean, literally, it is.
I don't want to retire.
It is kind of an all-in-one thing where all those things can work together against us, but you make it work together for the positive.
Yeah, I have so many tools I can pull from, and this is our pelvic health.
Right here, yeah.
And so I'm incorporating all. I have this company has all the written exercises for pelvic exercises, so I can download and print out like all the pelvic floor exercises. I can do an internal exam for a man or a female, determine which muscles are tense or weak, and give them appropriate exercises to do for those muscles and cueing.
Now, pelvic floor, I'm just reading off the side here, that's even for pregnancy issues as well, right?
Yes. Postpartum, several weeks postpartum. You want to make sure women get their pelvic floor back, snap back to shape. We see some prolapse, but only like grade 1 or 2, grade 3, you need surgery. So that's been interesting. I love working with these women. I feel like I do well with them and getting that back. It's very exciting. So
absolutely. Well, I mean, again, finding all of that in one spot, being able to, and knowing that it all comes down to balance, core, and everything you do here at Fyzical.
Yeah, and like if someone has trouble standing on one leg, Medicare studies show if you can't do it for 10 seconds, you're more likely to fall.
Oh.
And so I make sure they can at least stand 10 seconds. Well, why can't you stand for 10 seconds? And then you evaluate that further. Well, is it from weakness in the glutes? Well, let's do some acupuncture in those glutes. See if we can turn it back on. Let's exercise it. Is it from pain? Pain turns muscles off. Well, let's get rid of the pain. And so you just keep chasing it. You know, I mean, I had a patient earlier and they don't know why she's passing out. They had all the tests. They don't know. So they just sent her to me. So I'm like, okay, well, what is it? Well, let's just evaluate everything. Central nervous system, peripheral nervous system. You know, let's check for benign positional vertigo.
You're able to run all these tests right here.
And I ran them all today. Yeah, right before you got here. Okay. I had a patient. I had to run everything and then figure out like, okay, these are your deficits. I found out her eye or one eye did this thing, but whatever. I don't want to go above people's heads. But and I just gave her exercises and treatment for everything I saw wrong with her, whether it's musculoskeletal, balance, vestibular, whatever it is, and let's see what happens. And so it's exciting.
No kidding.
Yeah.
Well, one last look back here, all the way in the back of this amazing complex
so
here
we have
on
some
Paseo San
Pilates
Luis.
equipment. So we to do Pilates on, and so people will see Pilates in the community, so we can integrate that into their therapy if that's something they want to get back to.
Because Pilates involves a lot of stretching and
core.
Yes.
The whole
Which
9
again
yards.
goes back to balance, or strength and conditioning, and being able to use it in that particular way. I'm getting certified to become a yoga instructor, and I've a substitute teach for yoga classes, and I do pelvic floor yoga, which I've never seen. Interesting.
But I want to incorporate all that I've learned, and so that it's fresh. I'm getting out to the community. I've done it in Bisbee at the Royale, like on a Sunday at 10, which is great, and people love it, and it's incorporating all of that, and as well as weight training principles. Like when you weight train, you warm up first, right, and then you do your thing. Well, yoga, they just stretch, right? So I'm like, let's warm up first. And so I do pelvic floor stuff, like up on toes. Let's stimulate the tibial nerve to stimulate the pudendal nerve to get the tone of the pelvic floor going before we do anything else. Yeah. And so I'm incorporating everything I've learned, weight training, just everything all now into one. And it's wonderful. And I love to share it with you guys. So, you know, come on in with your scripts from your doctors and we'll get you set up. And I have a great assistant that thinks like I do. He's great. I couldn't ask for a better assistant, so we'll take care of you.
You can see the passion that Dr. Suzanne has for this. And if you are in need of any of the things that we talked about in this video, Dr. Suzanne, I know that Dr. Tap next door is able to take walk-ins. Is that a possibility here, or is it best to call ahead?
It's best to call ahead because you get the one-on-one attention. Because my forte is just trying to figure things out, what's going on, and what I test, retest, what works, what doesn't, and go from there. And if I had a bunch of people at once, it'd be hard to do so. So make an appointment so you get that one-on-one.
Excellent. And let's finish out in front of the big sign out here so we can see it one more time, because a lot of times people hear the word physical and obviously you think of the PHY, and this with the spelling makes it a little bit more fun and challenging to try to find possibly in a Google search or whatever.
Right. Well, they thought of it, 600 of them in the United States.
Yeah, which is absolutely unbelievable that this name right there, Physical Therapy and Balance Centers, is right here now in Sierra Vista on Paseo San Luis, right next to Tap into Wellness, across the street from the Warrior Healing Center. Just a couple of landmarks for you if you're not familiar with this area. But I mean, Dr. Tap's been here for 6 years now. This is a location that is well known for being Tap into Wellness. And right next door, Physical Therapy and Balance Centers. Dr. Suzanne is ready to see you. We'll have all the information in the post description, the phone number, their website, and everything else that you need to know in order to make an appointment today and consider doing that. And this is for not just for the elderly, so to speak. I mean, it's for the young and the young at heart, right?
Yeah. If you have any issues, I deal a lot with pain and neuromuscular and musculoskeletal disorders. And I love if you have something that's difficult to figure out. I mean, even if your doctor can't figure it out, have them send you here and let's see if I can give it a whack.
Yeah, I just don't want people to think that, oh, well, I'm not 65 or older, so I can't, I couldn't come here.
No. Yeah. And just know that if you work on something, you will get better. I started skateboarding in my 50s, and now I have a balance center.
And you're pretty rad at
it
too, you know?
And my balance has never been better because I worked at it. And so that gives me hope for all my patients. I'm like, just work at it.
What a great example.
You'll get better. Yeah, I feel that.
Example.
That's what part of the reason I do that.
Stop by. See Dr. Suzanne today. All the information is in the post description. It is Physical Therapy and Balance Centers right here on Paseo San Luis, right next door to Tap Into Wellness, right across from the Warrior Healing Center. Please give them a call. You don't need to live with pain. And if you've had a fall or some sort of fall-related injury, you need to stop by. Make that appointment today. Give them a call, and you'll enjoy this place. It's absolutely awesome.
It is
All these things are ready and waiting for you here at Physical Therapy and Balance Centers. Dr. Suzanne, thank you so much. Lovely to meet you today.
Nice to meet you.
And can't wait. Again, check the information in the post description. Please do us a favor. Share this video around. If you have some friends or family members who are dealing with issues like this, make sure you tag them in this video. Make sure that they see this, because this is so important to have in our community. And it's right here in Sierra Vista on Paseo San Luis. And, oh, go ahead. There we go. The bell has rung. Is that the ringtone? Is that I don't know what's going off here, but no. Please stop by, call and make an appointment. Stop by to Physical Therapy and Balance Center. See Dr. Suzanne, and you will see the difference. You'll feel the difference, and you will be ready to make sure that your core to wellness starts right here at Physical Therapy and Balance Centers. Have a great day, everybody. We'll check in with you again later on. Yay!